I will discuss Diagnostic Imaging Simulator, simu.Doc, using the chest X-rays as an example. First, I will discuss the basic section. The basic section consists of 10 trial questions, 20 level check tests, 110 learning the region abnormal shadows, 110 learning abnormal findings, 110 learning diagnosis, 20 test set questions, and 20 completion tests. If you can answer all the questions correctly in the level check test, you don't need to study basic course. If not, however, please repeat learning the region abnormal shadows, learning abnormal findings, and learning diagnosis, and try to answer all the questions correctly in the completion test. A test questions can be created and modified on request. It's possible to extract data on learning status of each individual. Let's take learning abnormal findings as an example. It consists of 11 groups, 10 questions each, with each group set at the difficulty level of 1 to 5 stars. Now let's solve a problem with 1 difficulty star. Adjust the browser magnification to match your device. The question image and the choices will be displayed. Please select the most appropriate finding from the choices. Click on the book icon to the right of each option to view commentary findings. Please refer to it as necessary. In the 1-star question, the location of abnormal shadow is marked only for chest X-ray. For the beginner student, there is a hurdle of understanding the terminology used to perform diagnostic imaging prior to deciphering the images. Select Nodular shadow and click Answer to display the correct answer and the case commentary. Next, let's solve a 2-star problem. Hint can be displayed for 2-star questions, so please use them if necessary. There is an abnormal findings here. Select high density area and air bronchogram and click Answer to see the correct answer and case commentary. The next question with 3-star doesn't provide any clues, so please select the correct answer yourself and click on the answer key. The difficulty level of images becomes more difficult as you get to 4 and 5 stars. You can check your progress by returning to the top and clicking on the record list. Please note, this is not the only way to master diagnostic imaging, as the basic section is just that basic. Once you have mastered the basics, please move to the practice. The practice section is also a group of 10 questions each, consisting of 180 introduction, 340 beginner, 360 intermediate, and 72 advanced questions. Please study up to the beginner level first to develop clinical experience. Now, let's solve the first problem of the introduction. Adjust the browser magnification to match your device. The image is displayed on the left, and the choice of region, basic findings, and diagnosis displayed on the right. The first question is whether or not there's a remarkable findings. In this case, select Remarkable Findings, then Answer column will appear. Here's a hint at the diagnosis is psychosis. So if you enter binaural film for the region and enlargement, and for the basic findings, psychosis is highlighted. However, if the wrong classification is selected for the basic findings, psychosis will not be highlighted. Select the correct basic findings and click on the Check and Answer to see the correct answer and the case commentary. The practice section is designed so you can naturally learn the relationship between region, basic findings, and diagnosis by observing case images and referring to the navigation system to answer the questions of region, basic finding, and diagnosis. Then go back to the question, select, and scroll down to the bottom and click on DA01. This is also a psychosis question, but no diagnosis is shown as a clue. Select bilaural hilar and mediastinum for the region. The basic finding is enlargement. Select psychosis as a diagnosis and click on Check the Answer to see the correct answer and the case commentary. You can check your own progress by returning to the top, clicking on the record list. You can also extract data on your individual learning status. In simu.Doc, you will solve each case in both the basic and the clinical section, one at a time. But if you wish to review the images and the case commentary, or if you wish to review similar cases, we recommend you use the DocNav in conjunction with simu.Doc. For example, if you start DocNav and select mediastinum, enlargement, psychosis, you will find many cases of psychosis. Case commentary for each cases is also available. Thus, by using DocNav together, you can broaden your understanding and learn diagnostic imaging efficiently. Please enjoy checking your skill as if you were playing a game.